Defibrillator surgery without interruption of anticoagulation. The pacemaker definition. A pacemaker is a medical device that uses electrical impulses delivered by electrodes contracting the heart muscles to regulate the beating of the heart. The primary purpose of a pacemaker is to maintain an adequate heart rate, either because the heart's natural pacemaker is not fast enough or there is a block in the heart's electric conduction system. Pacemakers are used to treat arrhythmias. Arrhythmias are problems with the rate of rhythm of the heartbeat. During an arrhythmia, the heart can be too fast, too slow, or with an irregular rhythm.
Heart. A local anesthetic will be injected into your skin to numb the area where the pacemaker will be inserted. The surgeon will make a small incision beneath your collarbone. The pacemaker's leads will be inserted into the subclavian vein and then threaded toward your heart until they reach the right atrium. Your surgeon
Who needs a pacemaker? Doctors recommend pacemakers for many reasons. The most common reasons are bradycardia and heart block. Doctors also may recommend a pacemaker if you've had a medical procedure to treat an arrhythmia called atrial fibrillation. A pacemaker can help regulate your heartbeat after the procedure. You need to take certain heart medicines such as beta blockers. These medicines can slow your heartbeat too much. You have heart muscle problems that cause electrical signals to travel too slowly through your heart muscle.
There's a lot of testing that we go through to determine whether or not a patient needs a pacemaker. One is first to decide whether or not the patient actually has an abnormally slow heart rhythm that needs to be speeded up by the pacemaker. We also perform testing to establish whether or not the patient has poor heart function, and if they do, whether or not a special type of pacemaker might actually improve the heart function. Usually we can gather the information we need from non-invasive studies.
The diagnostic test. An EKG is a simple, painless test that detects and records the heart's electrical activity. The test shows how fast your heart is beating and its rhythm, steady or irregular. Holter and even monitors. A Holter monitor records the heart's electrical activity for a full 24 or 48-hour period, while you do normally your daily activities. This allows the monitor to record your heart for a longer time than a standard EKG. So that was an EKG. How will a pacemaker affect my lifestyle? Once you have a pacemaker, you have to avoid close or prolonged contact with electrical devices or devices that have strong magnetic fields. Devices that can interfere with a pacemaker include cell phones and MP3 players, for example iPods, household appliances such as microwave ovens, high-tension wires, metal detectors, industrial welders, and electrical generators. Physical activity. In most cases, having a pacemaker won't limit you from doing sports and exercise, including strenuous activities. You may need to avoid full contact sports such as football. Such contact could damage your pacemaker or shake loose the wires in your heart. Ask your doctor how much and what kinds of physical activity are safe for you. The risks. A pacemaker surgery generally is safe. If problems do occur, they may include swelling, bleeding, bruising, or infection in the area where the pacemaker was placed, blood vessel or nerve damage, a collapsed lung, a bad reaction to the medicine used during the procedure.
implanting a pacemaker is an invasive procedure and it does involve a small amount of risk. There are particular things that we are worried about at the time of implant. We're always concerned about infection with any invasive procedure, and therefore patients always.
So those are the common risks. Ongoing care. Your doctor will want to check your pacemaker regularly, about every 3 months. Over time, a pacemaker can stop working properly because its wires get dislodged or broken, its battery gets weak or fails, your heart disease progresses, other devices have disrupted its electrical signaling. Thank you.